that time, the time you get to say what you want to be captured in the manifestos of the political parties. We're going straight to Kumasi, where our team is ready to bring you the Joy News Ghana Connect Townhall Meeting.
And so wherever you are watching us from, this is the Ashanti Regional Capital, Kumasi, and this is the Joy News channel. We are your election headquarters, and we're bringing you a special package known as the Ghana Connect Town Hall. Well, for days now, we've been on the roads to various parts of the country. We've been to Tamale, as many of you have joined us through the power of television. And all we've been driving together at your election headquarters, together with Star Ghana Foundation, has been to try as much as possible to get citizenry participation in our democratic process. And that is why we are Joy. Of course, Joy News is independent, fearless, and credible. And we're bringing you yet again another in the series of the Ghana Connect Town Hall, which is also broadcasting now on Joy 99.7 FM. We're also on the Joy News channel on all of our social media platforms. So it's a great opportunity for you, if you're within the Ashanti Regional Capital, to join us at Edum, where we are now, trying as much as possible to give the opportunity once again to those within the region to share their concerns. And what's unique about this town hall is we have a full cross-section representation. So we have representation from across the political divide. We have everyone joining us from the major political parties. We have traditional rulers also joining us. And for us now, we've been doing what we call stakeholder consultations or engagement ahead of that process. And that's what's unique about the Ghana the Ashanti Regional Edition. My name is Flex. And for those of you watching on the Joy News channel, feel free to share your comments, your thoughts with us as the time goes on. Of course, I have my colleagues, also part of the multimedia family. We're a very big family, even here in the Ashanti Regional Capital. We have Love FM, we have Inshira FM, my colleagues, Nana Boachi Adam, and also Eugene Osei. I see Nana Yaojima also in the crowd right now, who will be from time to time bringing us the concerns that we've been listening to all day. But this has been made possible by Star Ghana Foundation. If you're happy to be here, please a round of applause for Star Ghana Foundation. And of course, introduce those who've been helping us to make this possible at your election headquarters. And of course, representing long day that we've had. And of course, it's about to get exciting because we'll be respectfully giving the opportunity to our traditional rulers who are also joining us to share their thoughts. I also have with us Kofi Asare, who is the Executive Director for the Africa Education Watch. They are, of course, a very good friend of the Joy News brand. So Mr. Asare has always been on Joy News. And today we're bringing him closer to you, so he's able to help shape all of your concerns when it comes to the education sector. So our conversation will be on three sectors. We have education, we have health, and then we have social protection. I know that in the last few days, the Ashanti region has been facing with the topic of health, because there are a lot of issues regarding health, which we'll be hearing from the audience. To be hearing from you, because I was just hiding behind there, trying as much as possible to listen and eavesdrop and try and see what's been happening ever since the start of the day. And there are lots of concerns on social protection, which we would in fact get to the audience shortly to hear from them. But help us understand, what's been your impression so far about this town hall series that we've been running across the country? You've had many concerns. Doing is now justified, and that we need more.
Thank you very much, and thank you for the opportunity. Indeed, I've been here all day talking with stakeholders on the issues of health, education, and social protection. And yes, to answer your question, yes, I think what we set out to do, Star Ghana, what we set out to do, we are justified. We can hear from the people that the concerns that they are raising, across the various spaces we have been to, are the issues on our hearts as partners when we set out to do this. We wanted to know what their thoughts are on issues that affect them, especially in the areas of education, health, and social protection. We had initiated or commissioned desk reviews in these areas. We had done a review of the 2020 manifesto of the two major political parties in these areas. So we came with some findings to explore, let the people know what we know, find out if we are on the same page or we are in sync with what they are thinking. And true to form, from Cape Coast to Ho, to Tamale, to Wa, and here in Kumasi, covering 4 regions, Ashanti, the Bono and Ahafu region, we realized that the issues that we thought were the key concerns of the people are really being echoed or re-echoed across various spaces.
And it's also instructive to note that you've been attaching data, so you're not just saying
not at all
non-existent issues.
No.
What's striking to me was the health sector, for instance, and we'll be getting into the audience because they're very concerned about it. 1 doctor to 4,000 patients. That's striking. Why do we have this happen?
So the issue is we don't have, it's no, you don't even need data to tell you that we don't have many doctors to cater for the needs of the people. Right. And now data is saying this, so then we are not surprised at all. But what is even more striking is the inequitable distribution of even the few that are available. That some regions, Ashanti region, Greater Accra region, hosts a greater or a big chunk of the doctor population than the other remaining regions, and that is more striking because already we don't have enough. So there is a 1 to 4,000, which is way more than WHO's recommendation. And then even within that problem is also the bigger problem of the inequitable distribution, which leaves some parts of the country without access to quality medical attention, where in other places we say that they have it in abundance.
I see.
So,
and of course, we'll be getting to hear from those who matter as to whether or not those in the Ashanti region feel health should be the priority for many of the political parties. But inequality also persists, could be in the education sector. And I know when we talk about the education sector, there's no way we can't talk about what you've been doing at EduWatch. You've been carrying out a scientific assessment of what's been happening, for instance, at the senior high school level, because that's where we find a pre-existing government policy, which is novel, the free senior high school policy. And you say that, well, all is not well. We need to do some level of improvement. That also featured in some of the pre-engagements we've been seeing today.
Yes, of course, and rightly so. We've seen concerns being raised about the need to target the free senior high school policy. It's refreshing hearing parents from all the regions that we visited, indicating that they are happy to support government in contributing to financing the policy, so that the challenges with feeding and other implications of funding deficits, are resolved, so that government is able to actually increase how much it provides as free senior high school support to people from the lowest income quintiles, the poorest of the poor. And so when you hear citizens, commit and express their readiness to support the government to finance a policy which is laudable, it gives you the hope and then the understanding that we have gotten to the point where we see education as not just a sector, but then a facilitator, a conveyor belt, for achieving all the other social and economic needs in our lives.
And from where you sit, since this is about elections, do you see the education sector, much more precisely the free senior high school policy, for instance, driving or shaping the kind of political campaign messaging we are likely to see for the 2024 elections?
Even before, I have always maintained that the best government to review the free senior high school policy is the current government. Because of the politicized nature of the policy, it becomes quite difficult for a new government to come and then review it, because it will simply be like you are going to spoil it. And so if you look at the approach or the recommendations being made by the NDC, they are not talking about any external review, extensive review. They are only talking about we will add private schools, but the core issue of allowing those who have the capacity to pay something has been avoided, because both parties appreciate that, and I also do know that Ghanaians love their free regardless of the ramifications. And so I believe that the current government is the best government to start the review, and that's why I'm happy that in the general review reports of the IMF, our government committed to review the free senior high school. It contextualizes all the discussions we've been having across the country.
Yeah.
By way of inputs into government's intention that has already been made in the IMF review reports. And I think it's a good omen, not just for the government, but also feeding into the MPP's manifesto and the NDC's manifesto for 2024 and beyond.
I see. And of course, you are the experts. So when you get to talk, they say, okay, this is not, it's about the experts, about the books. But let's hear from those who will be voting on the day, right? We'll also be doing so, but we'll be doing that from a different perspective. So we'll now open the floor for comments and for questions. What we'll do is we'll segment this into the various sectors or thematic areas that we have. We have health, we have education, and we also have social protection. You just had Kofi Asare point out some issues in the education sector, and then also for social protection, we've heard from Dr. Tetteh as well. I want us now to, just start off from health, because in the last few days, and this is where I want to bring in my colleagues who are helping us do the discussion, and feel free to express yourself in the local dialect, of course, by the help of our colleagues at Tinshira FM, we'll be able to explain to our audience what's happening in the hall. And I must acknowledge the presence of some of our traditional rulers who are also here joining us for the Ghana Connect Townhall. We're still on the Joy News channel. We're on Joy 99.7 FM. And let me start off from Nana Wachiadom. And Nana, I'll just come back to you shortly on the health sector. You've done a couple of stories, so you know much more about what's happening. But we have also, very importantly, the political parties joining this town hall. We have Abubakar Razak, who's the Metro Director for Youth Employment Agency. He's joining us here in the hall today. So please, a round of applause for Mr. Razak, who's joining us. He'll be helping to respond, perhaps, I believe, much more from the perspective of the governing New Patriotic Party, and will be helping us to understand some more issues. We have Abbas Nuruddin, who is the Ashanti Regional NDC Communications Officer. Mr. Abbas, if you're here with us, please give it up for Abbas. And we'll be coming back to you because that's where the real fire is. You get to directly interface with the audience today. Nana Wachiadom, let me start off with you, the health sector. In the last few days, we've done so many stories on the Joy News channel about, I believe, the Konfanoche Teaching Hospital, right? That's been a burning issue for many within the Ashanti region. But help us appreciate what's been happening, for instance, in the health sector, because you've been following some stories in the region. What do you think?
First off, Blessed, it all started with Asante Hine's renovation of the Konfanoche Teaching Hospital.
Right.
Some major blocks in the hospital where he's intending to raise funds to complete some blocks at the Konfanoche Teaching Hospital. Second is with the dialysis issues that came up from the Konfanoche Teaching Hospital, mainly raised by the CEO of the hospital, Professor Ochiri Ade-Mensah. He raised some concerns with regards to the number of dialysis machines that they have at the hospital, and also the strike that came up by the doctors at the Confanote Teaching Hospital in regards to their accommodation issues. When they made mention of the fact that they are being evacuated from where they are currently to some places that they have no idea about, which led to a
so which
strike
means
action.
we agree indeed that this is a big issue in the Ashanti region.
Exactly.
And of course, we'll find out very shortly from the audience what they think. My colleague Eugene Osetu is also with us. He's with the Insura family, a part of the bigger and wider multimedia family. Eugene, Edzane, and I'm here work here.
Issue. Our regional hospital is not completed. We are a region where we have the Afari Hospital not completed.
Yeah.
We have many other hospitals. I'm a product of KNUST. Right. Our teaching hospital, which is the equivalent of the UGMC 800 bed, is not completed. Right. So I think that these three key areas are very central to the needs of people.
So since you're talking about that, let's get to it then. Let's find out if you're interested in also commenting on the health sector, for instance. You've been here in the Ashanti region, you've been residing here, you know what will shape your thoughts and what you would want to find out from the stakeholders and the political parties going into the 2024 elections. Just perhaps show by hands, we'll come to you and then pick up your thoughts. You can express yourself in whatever language. Eugene, over to you. Let's see if we can get some concerns.
Yes, so Patrona blessing Kenya and say what person will share what drink about Pumudin near ma. I'll be to my pedawansa. The Opesa manifesto no metro no MPP, NDC, CPP. The Opesa about Pumudin, which is health. Anything you want to talk about the health sector, key solutions or things you want to see in the manifestos of the parties. You person who want manifest batch of pages and about.
And please introduce yourself. And just before we have Alaji speak, I need to point out that we've also drawn persons from some adjoining regions or some other regions closer to the Ashanti regions. So we have a cluster of 4 regions. So we have Ashanti, Bono East, and Ahafo. So it gives you a wider scope of even what's happening beyond the Ashanti region. And so we'll give the opportunity to everyone here to express themselves. Yes, Alaji, go ahead.
Yeah, good afternoon, ladies and gentlemen. My name is Osman bin Ahmed. I am the CEO of Sudu Baba Foundation. My sister talked about the health issue in the country and gave us a gloomy picture. But my major concern is about those at the other regions, because we will see that there's a lot of disparity over there. If you look at the number of doctor-patient ratio, we are saying it has reduced. What about those in the north and other areas, other regions? What other incentives or what method are we going to use so that at least they will also enjoy some of this facility? Because if you look at it, actually, the suffering and then the disparity is too great. So I wanted the politicians to add it to their manifesto on the method that they are going to use in making sure that this issue is
And
addressed.
just before we hear from them, you've been working in these communities. Tell us about some of the day-to-day challenges you face and what practically you would want these political parties to do in terms of their manifesto.
In my capacity as a traditional leader and I also run as a foundation, I go to all these areas, I can see that the level of disparity is too great. There are issues where people have to walk a longer distance before they can access some health facilities, which to me is not saying the right thing, because everybody should enjoy the national cake. So we try and then look at it and then push certain issues there. At least that can even go a long way to reduce their movement from the north to the south. Mm-hmm. So that most of this, if you like, the other guy was saying that if you go to other areas abroad, everything that is in the village is in town, is also in the village.
I see.
So we should make sure that these things are pushed up there. new projects should not be included, but those that are already existing should be completed so that at least we don't waste resources.
Okay, so you don't want the political parties to go into building more facilities.
They should rather complete the uncompleted ones.
Okay, just hold on for me. In the meantime, if you have any concern, you also want to speak after Alaji, then you would have the opportunity. Just draw the attention of my colleagues. They are, in the audience. They will definitely come to you so you can share your views. So you don't want the political parties to construct new hospitals?
What I'm saying is that you realize that per politics or per their ideology, they start a project, and when a new government comes, it abandons it and goes to another. It means we are wasting resources. I quite remember at the Comfanoti here, a whole building was brought down because it has stayed there for about 10 years without, it was weak. So these are something that we don't have enough, but we rather waste. So there should be a policy that each government that comes should have an idea of continuity. Where the other government have stopped, they should continue, so that at least we don't waste our resources, and then we should channel it into where it is needed. Another issue that most of the people the government don't have enough, but those who formulate the policies have a lot of sweetie packages. That one you should look at it. It is this idea of ex gratia and all those things. That doesn't make sense, because how can just a politician be there for 4 years, then he takes everything? He is there to represent the people, but rather he's there for his own interest. So they should look at all these things and making sure that it's solved.
How about the doctors?
Well, the doctors are killing themselves. Yeah. They don't leave the country just for nothing. They are there, they are not well paid. The condition of service is not good. But a politician is sitting somewhere, per the policy and then the program, that is all the sweet things that he's putting it at the packet. That one is not fair. So nobody wants to leave his country. If the conditions are good, they will stay. So they should rather have a good housing package, all the facility, their salaries and everything should be okay. Likewise, the nurses, they are also killing themselves day in and day out. You go and see where they are living, it's not something to write home about. So there should be a program to make sure that their welfare is well catered. Then when we do that, I'm sure it's going to have it.
Please give it up for him, and we'll be getting more of the reactions as we go on. But a summary of what I understand, based on what you're saying, you want a good condition of service for our health workers. That way, they would stay within the local communities, and then also halt the construction, at least for now, of the new health facilities. Let's finish what we have, and then we can continue. We'll be, putting that before the political parties to see what they have to say about that. So if you're a representative of any of the political parties joining us, please take note of these concerns. We'll come to you shortly. We have a young man there. I'll come to the rest of you, but let's do the young man, and then we'll go ahead. Yeah.
My name is David Dankwayeboa from Bono East. I want to emphasize on what the gentleman just ended. I say, Abosobane my ejapai. So any government that comes should make sure to complete any projects that the previous government started, like the Agenda 111. It has to be completed, and it must be completed. For me, I want to see in their manifesto where they are going to get the resources to do any kind of project, and they should come with figures, because we don't want a situation where a government will come telling us we are recklessly borrowing, but they are also borrowing. So you want to see where they are going to get money to do such projects. And then I also want to...
When you mean they should come with the figures, what do you want to see? Exactly what do you want to see?
The cost involved in constructing, yes. Right. Okay. The cost involved. Because we've also realized that corruption is also draining some of our resources. They should come up with innovative ideas and initiative that will deal with corruption.
Okay, in this procurement process. Health for now, so let's deal with the health, and then we get into corruption. But you're saying that if you want to start any health project, for instance, put a cost to it. Don't just come promising us a health facility or the other. Yes. I believe that's what you're saying.
That's correct.
Right.
And then the second point is incentive for specialized sectors.
Okay.
Maybe a doctor. There should be an incentive for such people. Yeah. If I would suggest that any government that wants to come should scrap that allowances for nurses. They should be giving it to people who want to specialize in certain areas, right, that we can get qualified and quality health personnel in our system. Thank you.
Thank you very much.
So, Blessed,
okay.
also,
we have some more.
Yes, I have someone from the Zainab Foundation.
Yo, me pacho, me so much in tram de bansen. Pacho Zainab Family Foundation me wo Ahafo region. Me ye juma wo health sector. Me a receptionist and also a radio presenter. Hosting a program Young World. Now in the course of our working, no, yehu eniyama bebre no kwasa me course for health hard drink, especially national health insurance. And when you best rate aban say, sa kwata sika wo twa hu sika services the drugs no. Yes no. So won tumu emma hospitals and say na be ya omo so betumi aye adwuma no na omama your clients no better drugs. And na afen so ye ka no sa we no so aya wo mo ye no. Apart from drugs, you know, so no, you were able to say, kidney issues, no, and I feel so heart failure. I young kwala under age, no, bit 4 years and 5 years. Okay, yes, sir, I buy some go to me. One fan can health insurance scheme, no, because I'm more funny be a last year, experience be an aquasem. Na are hope I so na support. And I feel so. My last one, me de eka hono, and also na me stress see I to abey. Ye na yen dream say your policies are ye no, your health we need ye. My enfano in your politics asem. Ne mo yen hwan ye bebo awo man no, echiri ma no, ene ye nyina me da se.
And for the benefit of our audience who are watching us,
yes, so
Eugene, let's explain that. Yes.
So she spoke about 3 main issues. She says she's coming from the Hafu region. And the first issue she raised was that governments will ensure premiums when they treat people, medication and all that, the premiums are paid on time. And the second was also that the government should consider rolling onto the National Health Insurance Scheme certain diseases or illnesses that affect people under the age of 5. Right. And she did mention of kidney issues with underage children below 5 years and also heart-related conditions when it comes to them. And the third issue she raised was that going into this election, people should ensure that when it comes to the issues of health, there's no politicization of same. So that, those are the issues.
What I want us to do now is to take at least 2 more, get some reactions, and then we'll come back for another round. Shall we? And
right,
Eugene,
yes,
let's give
let me
special
take,
dispensation.
Yes, let me take this gentleman. Please, your name.
Right. Let me go language.
Feel free, sir.
Kakran pesa me can say, at the age of 7 years, and I'm disabled. I was injected. I got sick in a medical hospital. They all me panic and I'm 90 me answer beam. Number 8 disabled. A free one, my first caliper, me show Confanoche as a central hospital. Omo share me caliper, me say me 50 years. Valentine. And paying for no share me calipers as at now, they are still at work. Omo ko pension. And so Ghana Health Service, say Confanoche, say Ghana Health Service. Sa building na you see hono. And on a yesi new building na you bugu and cause me sa dine foundation at the early ages, na iron rose season. And na you see ni buegu. Sa dine kitwa na me share me caliper no mono. And that's we hon my year and the tedanya is ho. Ghana has served na confanoch a dear no more ya fa ho. Sabi Kumasi and Ghana, your central hospitals confanoche. No orthopedic center is dying out. Ya boswa nti dia na sese ye ye hu etu na mo bi ye pen fo chese o mako ye bi o be kwai. How come say me she caliper and na bibi mfa bi ma na makohwe ase caliper na kubu e be de na metima fa taxi and I drop him bi akọ no che na me ko be kwai me ko aduan kwanta me ko nsanwom adentina central hospital na ye ho adwumai omo hwese omo de sa orthopedic center na beba confanoche amai
right
na day in and day out accident is ye twa nipa nan omo nyina here prosthesis ye won kola polio nti omo be disabled. How do we get data on all these things?
And that's a very critical question you're raising. Practically, what would you want the political parties to do about this?
Want political
in terms
parties,
of their manifesto, what would you want to see?
We want the political parties to have a proper data. They shouldn't just estimate our population like we have 30% of persons with disability. We did a population census. What is the data? Where is the data of persons with disability captured in this data? For them to have a proper planning and whatever it will cut across, whether education, health, and every other sectors, for us to get all these things
I
properly
see.
done.
And because your case is very unique,
Yes, please.
and for the benefit of our audience, you've been using the Kumfuanochi Teaching Hospital, I believe.
Yes.
You know about the situation previously and now. It's been a topical issue. What would you want to see done
I
about
want to
it?
see
Yes.
disability issues well attended to. Because without these issues or attending to us, we are dying out of the system. We are finding things difficult to access these facilities around us.
Please give it up for him. And Eugene, just explain briefly what he was saying earlier. Yes.
So he did mention that he got into the condition when he was 7. So he's now 50 years. So that has been 43 years. And he did mention that the facility where he sought treatment, the structure and the feel of the place is still the same after 43 years. And he is admonishing Otumfuo as part of the Hill Kumfuanochi project to ensure that the orthopedic unit at the Kumfuanochi Teaching Hospital is fixed, and also such department taken to other parts of the region, because if someone is at Bekwai, they have to travel several kilometers to come to Kumasi to seek that treatment.
Okay, what I want to do before we get reactions is to move to the other wing of the hall because they seem left out. Nanaya Aljima is there, and Nanaya, let's see quickly if we can get one more concern before we move on. Yes, okay, go ahead. Yes, go ahead, sir. Your name?
Yeah, I'm Emmanuel Sando. I would like the political parties to work on the doctor ratio. It's a very important issue. If every district at least can provide about 10 to 20 students to be trained as doctors, I think it will go a long way to help the situation. Thank you.
Thank you very much. We'll take another round shortly. I just want us to digest all of the issues coming up, and then we'll put that before the political parties. And wrapping up from the point you just raised, there's now a link, Kofi, a very clear link between education, the power of education, and health. Because for a very long time, we seem to see a disconnect when you talk about the two issues. But now we are getting a sense from at least our audience that, you know, they are linked one way or the other. You've been listening to some of these concerns. How do we marry the two? I think Doc would have to help you with the microphone. Yes, Kofi. Yeah.
I see the low participation in STEM as an underlying factor. I appreciate that within the education strategic plan, which we are encouraging both political parties to see with their manifestos, the education manifestos. There is a target to reverse the STEM to humanities ratio and ensure that 60% of Ghanaian students end up offering science, technology, engineering, and mathematics subjects by the time they get to tertiary. But we have missed out of that target. As we speak, the ratio, only about 12% of girls are doing STEM, and then the general ratio is about 30-70 or so.
That's really low.
Yeah.
Right.
Yes. So we can only sustainably cure that if we begin to promote the participation of boys and girls in STEM from the basic level. Because if you are not doing science or STEM at the basic level, you cannot do it at the secondary level, or you cannot develop the interest at the secondary level, and you cannot proceed to tertiary, and you cannot become a doctor or a nurse in that community that you hear
I
from.
believe the gentleman asking, of course, we say that's long term. Short term, what do we consider? Because the 2024 elections is just around the corner.
Yes,
what more do we do in the short term?
Yes, I don't believe in quick fixes.
Right.
Short-termist policies have landed here. I want the political parties to buy into the long-term plan of government, okay? So that within 4 years, if you promote STEM at secondary level, within 4, 5, 6 years, you'll be seeing results at the tertiary level. However, I must insist that we must move a step further to incentivizing medical personnel accepting rural posting. It appears the incentives currently in place are not enticing enough. The gap between a doctor who works in wage salary is so minimal that it is difficult to prevent, to attract people. So we can look at in the short term, enhancing the incentive packages for health personnel who accept to go and work in the deprived areas.
Okay, so what I want us to do now, so we don't lose track of all that we've spoken about so far, is that we started off with a concern about, first off, halting the attempt to build new projects, put them on hold, complete everything we have, and then you can proceed. I believe that was the concern. And also the issue about figures, which one of the audience also raised with us. Then we had the issue about NHIS. Doc, let's talk about that briefly, because that's also a very, one of the burning issues in the country. And it's not just for this part of the country, for Bono or for the Ashanti. Across the country, I'm sure you've gone to many parts as part of this engagement. How do we get to have all of these political parties realize that it's an issue that they must put into their manifestos?
Thank you very much. Yes, as you mentioned, it's a concern across, not just we are not hearing it here for the first time. It's the fifth place, and that's the theme that is recurring through all the discussion. What we hear is the efficient use of resources. Right. We may not have enough as a country, but then how are we efficiently using the available resources? Right. So there is the mention of scrapping allowances for nurses. Now we have exceeded the WHO's recommendation for nurse-patient ratio. Many nurses are being trained. They are not posted. They are at home, losing their skills by the day because there is no opportunity to practice. Yeah. And when they go into the hospital, they go to practice after years of not. Yeah. There is chaos. So what I hear across all 5 town hall meetings is the efficient use of resources. Do we have to continue paying nurses allowance to train more nurses that we are not posting or using? Could the allowances be channeled into incentivizing those who are already practicing so that they would accept postings into areas that they are needed most, the underserved areas? Yeah. That's something that could be considered so that we are not populist around. If we don't give them, they are not going to vote for us. Yeah. So we have to. Because when it comes to health, there is something that was said during the other town halls by the consultants that in education, you could find a teacher who teaches in a public school, but has his children in a private school because he can afford it. You don't have that luxury when it comes to health. Because at the time of an emergency, you don't even get to make the choice. You don't even get to say, take me to this place or take me to that place. So health is so crucial. I'm not saying the others are not, but health is so crucial. And that is what we are hearing throughout the conversation. So don't cap NHIS. It's a reason you are levying. I mean, there's a reason for the fund or for the scheme. At what point do you decide what should go into health, which part of NHIS should go into health, and which part shouldn't? It's not. It's just not right.
Okay, we have the opportunity to hear now from the political parties, and then we'll go back to the audience. I believe we've heard about 5 concerns mainly: NHIS, completion of pre-existing health facilities. There are a number of issues coming up. So let's get to Razak. And see if we'll get to hear what the new patriotic party, I believe, has in store for the people of the Ashanti region. But Razak, I want us to start from, the issue about the Komfo Teaching Hospital, because it's of concern to everyone here. What are you doing about it? Because we have a practical case before us, right?
The 860. It's just unfortunate that we couldn't look at the renovation or how deplorable the facility is. But as a government, it's not that we are showing unconcern about the activities of Komfo. But that block, that 860 maternity block, which was abandoned for over 40 years. It was abandoned for over 40 years. It is this current government who has taken the initiative to rebuild it and make sure that Komfo have a new face. So it's not an issue that the government did not care about.
But do we accept now that you've lost the opportunity? So now I want to know what you plan to do in your next manifesto. what are we likely to see as the plan for that health facility that the NPP would want to put across, through your manifesto?
Fortunately, the manifesto is not out yet.
Right.
And there is a team put in place, an eminent personality have put in place to look at the health sector. And I believe, per what just transferred with what Otumfo have just done, I think the manifesto committee will put Komfo into thinking so that the good people of Kumasi will see a new face of Komfo.
Okay, because we heard from the audience saying, come with the figures, and by extension, they want to see practically what you plan to do. Let's fulfill that for them. What's the plan? What exactly is the plan? And what do you think you'll be able to do?
When we talk about plans,
right.
When we talk about figures, it's unfortunate. How can a political party plan without having figures? Or how can a political party plan write a manifesto without considering figures? So probably the ordinary might not understand because but
help us understand, because that's why we're all here. So what do you plan to do so they can hold you to account?
Unfortunately, yes. I'm not on the manifesto committee of the health team.
Right.
I can't speak a lot about it because I am not on it.
I see.
I'm not a health expert. I'm not on the...
But as a political party, you are obviously concerned, as you're telling us. So what do you plan to do?
We are concerned. Let's go back and see. My Alhaji spoke about the disparity between the urban and the rural, the healthcare.
Yes.
Let's go back and look at how feasible is Agenda 111. It's very feasible. When you look at the figures, when you look at the rate of percentage of the project, it means the government is really serious on health issues. Hopefully, by the end of this year, some of the projects might be completed because some of them are about 78, 68, 55% of the construction. So if by the end of the year, if we are able to complete all those projects, even the pressure on Komfo will reduce. So it's not an issue that the government have just neglected. When you look at the various projects going on, you could see clearly that the government have a very sight on health issues.
Okay, and there's also the issue about the NHIS. So let's quickly deal with all the concerns. The NHIS and the completion of the old projects. So you do the two for me so we can hear from the NHIS.
Completion
what do you plan to do?
All the political parties can be held responsible for not completing projects that has been started by previous government as we speak. The Irojet project, which was going on in Kumawu, started way back President Kufuor term. It's just completed and inaugurated just this month. The one at Afere, it did not start today. It did not started under even my brother's NDC time.
Okay, what do you plan to do?
It is almost, all of them are almost completed. The one at Afere is almost 95% complete as we speak now. The one at Kumawu has been completed. The one at Bekwai is almost 75% completed. Just last week, the president inaugurated the one at 10. So it's not that those things have been neglected. All of them are in a various stage of completion. And we can all attest to it. The pictures are evidence for all of us to know how serious the government are about those projects.
And then the last part about the NHIS. Coverage and improving, the system. What do you plan to do?
I think every Ghanaian is entitled to NHIS. I don't think there's a restriction on any Ghanaian that you are not qualified to enjoy NHIS. I'm wholly hoping that the facility will improve because projects like NHIS and every day the numbers keep on shooting because the less endowment people are always eager to access the facility. So I think we can all hope that we can have improvement on the delivery of NHS.
Okay. Let's hear from the NDC as well, because they are also one of the key stakeholders going into the 2024 elections. Abbas, your party has spoken. Your party leader obviously has spoken about a number of issues, what he plans to do if given the nod. But you've heard the concerns. Just take them one after the other for us.
Well, thank you very much. And I would want to start on the issue of healthcare delivery in Ashanti region. You know, and with particular emphasis on Komfo-Anokye. You know, Komfo-Anokye is a referral center for 12 regions. Mm-hmm. So the utility of Komfo-Anokye goes beyond the confines of Ashanti region. Okay. So regardless of how resourced Komfo-Anokye is, it will get overstretched at some point. So there was the need for other first-class health facilities to be built at certain locations to at least ease the burden on Komfo-Anokye.
So what is the plan of the NDC? Yes.
It was in this regard that President Mahama commenced about 8 hospitals, 8 major hospitals in the Ashanti region. Talk of the 500-bed military hospital at Aferi to serve the Achuma and Ahafo enclave, the 120-bed hospital at Fomena to serve those at Fomena, the 60-bed district hospital in Konongo, the 120-bed district hospital in Kumawu, and the 250-bed district hospital at Seria. Regrettably, this government came in and decided not to complete.
I would appreciate it if we talk about the solution. What do you plan to do, and how do we get this problem solved? Because the concern has been raised. Yes.
To get those programs completed, to get those projects completed. The point I was trying to make is that if this government had invested the monies, it invested in the Agenda 111, which is not completed in those hospitals, we could probably have them running now, and we will not be talking about Komfo-Anokye.
Okay, are we getting that guarantee, based on what you're saying, that in the manifesto that the NDC would outdoor, it is your plan to complete all of these facilities?
President Mahama has said it already, and I think it bears repeating, that immediately he assumes the reins of government in 2025, all projects, not only healthcare projects, will be completed before new ones will be rolled out. And I think that is the way to go, because most of those projects lying fallow were constructed with monies of the people. So it is important the little resource that we have is pumped in there so that the people can have the benefit of it.
Those facilities completed, the next point would be about the conditions of the health service workers, because you heard our panelists talk about that. What plan do you have, and how will you factor that into your manifesto as well?
One key factor in the provision of quality health care is the quality of health personnel available, and in our case, doctors and other allied health personnel. One area that I think we need to look at, which goes beyond, the politicians, is the tight entry barrier into our medical schools. In a year, you could have like 10,000 people applying to do medicine, and we end up only taking 1%. These people go out to Ukraine, and they are allowed to do medicine. If the challenge is accreditation, we need to accredit more institutions.
What do you see as the challenge, and how do you plan to solve that?
One challenge is the tight entry barrier. So as a government, we will look at widening up the entry barriers into these medical schools so that more people will go in there. So at the end of the day, if some are leaving to seek greener pastures elsewhere, we would have a majority still in the country serving the people. Okay. Then we would also look at the provision of additional incentives for health personnel who would want to go into the rural and the deprived communities. If you look at Ashanti region, for instance.
Okay. Yes, just land on that point for me.
Almost all our health personnel are centered in Kumasi. Nobody wants to go to Agro-Esum. Nobody wants to go to Konkontre so, because the kind of facilities they are able to enjoy in Kumasi, they don't get it there. So there is a need for them to be incentivized by way of some top-up in remuneration.
I see. So let's close the chapter on health, and then we can take social protection and education, or probably education before social protection. Nana Boachiaro, you have someone with you?
All right, so I have this gentleman here with us. He's coming all the way from Techiman. So what's your contribution there?
Okay, thank you. Social protection, even as government have intervention like the LEAP.
Yes, we'll come to social protection. Let's close the chapter on health. Your point on health.
Health, I have two key issues, accessibility and affordability. Access to essential drugs and care services to diseases like those who are on dialysis. Obviously, people find it very difficult to have access to it. And when it comes to paying for the service, virtually most of our Ghanaians find it very difficult to pay. And I'm looking forward to the state government to come up with a comprehensive policy that will aim to sustain those people. And again, local pharmaceutical industries and exporters, they can think of giving them incentive packages so that they can cater for those essential services as far as the health sector is concerned.
Thank you very much.
Priority to the women in-house. I think we need to be doing that as well, so we can have more women also participate in the process. Let's see who's next. Eugene?
Okay, so I have another gentleman here.
Okay, thank you very much. My name is Inokosu, and I'm from Obuasi. Upon everything that we have discussed here, I was just thinking about one thing. Where are we heading to as Ghanaians? Where do we want to get to? Chapter 6 of the 1992 Constitution makes it clear that there should be continuity in every developmental project in Ghana. So what happens? The question I ask myself is, what happens? We build one infrastructure project here, the next government comes and the government doesn't continue. Why? Because we are not pinning them to what they are doing. If we are supposed to pin them, like fashion out a regulation from chapter 6 or an act from chapter 6, whereby it states that every government, whatever the political party, when you come to government, whatever plan that we have as a Ghanaian, being it in education, being it in the health sector, you are compelled to continue.
Okay, the name again, sir?
Inokosu.
We have, for instance, the National Development Plan. Is it the case that you feel that's not enough and we should have a more binding policy framework?
I think that probably is not all encompassing in terms of the consultation. So we should have a much more bigger consultative assembly or discussion, whereby we will come out with a clear vision for Ghana. In terms of health service, this is what we want to do. These are the infrastructure we want to put in place. These are the targets. We go to IMF and they give us targets. They say you have to achieve inflation at 6%, and you are compelled to do so. How come as a country we cannot have targets for ourselves? That let's say in 2025, we should abolish all schools under tree. Why can't we do that? Why can't we do that? Because we cannot
the political parties are not far away from us. What do you want to see briefly?
What I want to say is that let's fashion out a regulation or an act from chapter 6.
I see.
Whereby the political parties will be pinned to it. If you do not do it, you will be prosecuted.
Okay,
I
guess the point is well made. Continuity, and many of you have raised the concern as well. Yes, sir. Kindly introduce yourself.
Yeah, my name is Baba Adams.
Yes.
I'm still on prioritizing health needs.
Right.
We don't have to allow politicians to come around, even with the manifesto. If they don't execute it, what do you do? Nananum, I applaud Otumfo for the work he's doing at the General Hospital.
Right.
Nananum should call the political parties, prioritize their needs as far as health and education is concerned, and then engage them so that they will make sure that whatever manifesto you are coming with.
Okay, so I see your concern that some of the political parties would say very beautiful things now, perhaps put them on paper and would not execute.
Yes. The other one has to do with this regional capitals with a lot of resources. Mm-hmm. The corporate social responsibilities of some of these companies should not be, can't go and buy football and say you are paying corporate social responsibility. Let's channel some of these, let's direct them as to how they should use their corporate social responsibilities. If you are into mining and you are polluting our water bodies, and there's lung disease all over the place, we should be able to tell you how you should apply your corporate social responsibility.
I see.
Thank you very much.
Thank you too. Let's close the chapter on health. I will just mop up. Yes. There's one gentleman in front.
So there's another gentleman here.
Eugene, okay. Right after that, we'll come right to you, sir. Yes.
Okay.
Please introduce yourself.
Yes, my name is Simon Asori. I come from Sunyani. I want to talk on the health sector again, especially the regional hospital in Sunyani. Last year, the president credited it to teaching hospital. But as of now, there is nothing to show that it is a teaching hospital. We still have referrals all coming to Konfanochi. We do dialysis machines, nothing. Even personnel, experts that we need for certain diseases, we still refer people to Kumasi here. So we would like the government to commit itself to making the Sunyani Regional Hospital a teaching hospital, as he himself has accredited it. Secondly, we are also working in communities with volunteers in terms of health. And you realize that the community volunteers that we are working with them, they seem to have knowledge in some of the health issues than the nurses or the community of nurses that are posted. When you talk to them, they tell you they were in the house for 3 years, 4 years, 2 years, and they posted them without orientation. So they have come to meet new things, and it's a challenge. So we want government to also have orientation courses for these nurses who have sat in the house for long before they are posted, if we are talking about quality.
And I see someone applauding him there. Please give it up for him. And Eugene, just come right in front. Okay.
Yes. There's another gentleman here. He wants to contribute to the health discussion.
Okay. Right. So, please introduce yourself.
My name is Lawal Bin Mohammed. I'm representing No More Neglect Foundation. It's an NGO who train PWDs in cell phone repairs to have a training skill rather than ending up in the streets. I wanted to contribute on the health aspect of our discussion today. Although my brother here talks about accessibility when you go to some health facilities, it's not accessible to people with disability. We are finding it very difficult to also sometimes even to see doctor or to go to a lab. Sometimes you see just a small building, they call it lab. You can't even access to go inside, to go and maybe they get your blood or whatever is it. You can't get access to that. Sometimes you have to do it in public, which is, we don't have privacy, which is not right. Privacy is also part of human rights. I want to urge any government, not only MPP or NDC, any government, they should prioritize the health of its citizens.
Okay.
A healthy nation is a healthy people is a healthy nation.
Right.
Thank you.
Okay, thank you so much. Eugene, come up front. There's one gentleman in front. Hello, sir. Please introduce yourself and share your concerns with us. Yes.
I'll defer it. I think it's on education.
Okay, so we'll do that. Okay, so we're then closing the chapter, I believe, on health. Okay, there's one gentleman behind. Let's close the chapter on health.
Okay.
Oh, there's also one lady.
Okay.
So I'll wrap up with you, with the lady behind you, Eugene.
Okay,
yes.
Blessed, thank you.
Right.
Mine is just on the expenditure. The political parties that are here today. Right. If you look at the presentation of the doctor here, she made us to understand that it's 4% of our GDP, which is being sent to health. How come 4%? Meanwhile, World Health Organization is saying that it should be 15%. So, blessed, 4% is too small for the health.
What would you want the political parties to consider?
I want them to increase the percentage. They should increase the percentage from the 4% at least to 10. It's okay, but 15%, welfare organization is saying 15%, and you are using 4% expenditure of our GDP. So that is why we have so many problems in our health sector. Right. So they should do something about it.
There's an intervention from Kofi who's also listening.
Yeah,
yes.
I appreciate that. Yes, there's a need to increase the health sector share of the national budget. Right. And the MPP and the NDC reps are busy on their phones. I hope they are listening to me.
They will definitely respond.
Yes. You see, the challenge of the National Health Insurance Scheme. Okay, I'm not saying that in the past there were no challenges, but today's challenges with the National Health Insurance Scheme manifesting in the creeping cash and carry, as we all discussed earlier today, is primarily because the NHIS has been capped. In 2017, the government capped some statutory funds, some earmark funds. And the capping allowed the government to divert up to 60% of the accruals into those funds.
Right.
So if, for example, if 10 million is supposed to come into NHIS through the National Health Insurance levy we pay, because of that law, the Finance Ministry takes a huge chunk of the 10 million.
Okay, Kofi, so how do we address that? What would you want the political parties
to do? The political
to
parties will need to make commitments that will lead to uncapping the National Health Insurance levy. If we don't uncap the National Health Insurance levy, our hospitals will not have money to pay their electricity bills. And you will be asked to pay for drugs as you are experiencing. And so, political parties, let's hear from you about how you want to uncap.
That's a direct challenge from Kofi, and not just Kofi, but in fact, the concern has been raised all over the place.
Yes.
Okay, so we do the lady, and then we'll see if the political parties will commit to that. Then we close the chapter on health.
Yes.
Hello, Ajwa.
The health minister say herbal preparations no adverts no because one preparation can cure about 200 diseases. And the pastors, so on when omunjai oyare abrame hansa. There were some of the terminal illnesses like HIV, diabetes, and hypertension. Then they will come back in a very deplorable situation.
Okay, Eugene, let's do that quickly.
Yes, so Ama Sewa Ajwa Sewa is saying that he wants the health minister and the political parties to put in their manifesto that they regulate the herbal medication system, and also pastors who prescribe medications to people without having the requisite license to do so. Because per her experience, most people come to them with terminal illnesses and they trace it to these factors. Yeah. So they want the parties to regulate the sector.
A direct one to the political parties before we go. Abbas, NHIS.
Well,
Kofi is concerned. Let's deal with that, and then we talk about the last point.
There is the need. The national health insurance, even without the statutory capping and realignment policy, was woefully inadequate. So taking up to 60% out of the national health insurance levy amount to collapsing the scheme. And the statutory realignment seemed to have had effect on the efficacy or the effectiveness of the national health insurance policy, say that now if you take the card to the hospital, it's almost useless.
Okay, so what are you willing to commit to? Yes.
The first step is on capping the national health insurance.
Are you committing to
that?
Yes. Kofi's concern.
Under the NDC, there was no capping. So it's clear, it's obvious. If we say we will uncap, I think it's believable. The other aspect is the allocation, the percentage of the national health insurance that is used in the payment of claim. If you look at the national health insurance allocation formula, in 2023, less than 10% of the capped national health insurance levy was used in paying claim. But in 2016, we were doing like 50-60%. So there is the need for the National Health Insurance Levy to be used for the purpose for which
the
it is
concern about
intended.
herbal medication and possibly some policy framework around it.
Well, now if you go to some hospitals, there is a unit on herbal medicine. So it means we are getting somewhere. But there is a need for more regulation because most of these herbal products do have their own issues as well. I don't want to destroy somebody's business. Sometimes you hear a person advertise one product and it cures everything. Right. That is medically impossible. All of that, there has to be some kind of regulation, and that is what the NDC is bringing to the table.
Which is to do what exactly? What are you planning to do?
One, to tighten regulation, quality control, to ensure that the herbal products on the market are able to treat the kind of diseases they are being advertised to treat. You get the point. That is one particular aspect we will focus on.
All right. Razak, the point about, increasing spending.
I want
yes, you can respond to that, I want
to add something to the herbal medicine thing. I don't want to politicize it. It's a general concern. Everybody who is sitting here, every Ghanaian knows that the issue of herbal medicine is giving us challenges, a lot of problems in the country today. So I think, i.e. my political party or his political party, it's a general concern that we all have to look at it and see how we can solve it. Because there's a particular medicine, I also can't mention the name. He said, take 8 bottles before you can get well. When you take 8 bottles, you will be free of malaria. So after taking 8 bottles and you go to where malaria is breeding, where mosquitoes have been bred, are you not going to get malaria? So the kind of advertising and the way we go about herbal medicine, I also personally think is very challenging in our society, especially people who doesn't even understand the concept. So I'm hoping and praying that i.e. my government or his government, we should all look at it and see how we can regulate it.
I see.
That one there is a big challenge that we...
Okay, so then we're closing the chapter on health. Nana Yaojima, I'll come to you shortly, but Dr. Tetteh, let's close the chapter on health. I see there's the continuous concern about continuity, right? Why do we have this challenge, and how do we address it completely? To have, some sort of, I don't know if we should be calling it a bipartisan movement towards having one framework that will guide all of the political parties, regardless of which regime is in power.
I think that when Kofi was talking in his presentation earlier, he mentioned the concern about legacy projects, that people are more interested in legacies. Right. I mean, this is what I did, and that is what is leading to not continuing what somebody else started. I also think there is the thinking of, well, if the person was doing a good job, why did you ask to be booted out? Because you are continuing with what the person has started. So it's about the whole idea of putting Ghana first, putting the people who vote for you first, and what matter to the people. Because if you have uncompleted projects, and it's their money, that you abandon, start a new one. So you don't even listen. So you come to the people year after year, they talk to you, and you are really not listening, because if you were, you pay attention to the resources that they are contributing to the development of the nation, what you're not continuing. And it gets worse by the years, right? The issue of not continuing, abandoning projects and not continuing with other, it gets worse.
There's one person in the audience who says, let's consider a law, a framework to bind the political parties. Is that the way to go?
I'm not sure that, I don't think that as a country, what we lack is laws or regulations. It's just the implementation and doing. And then our people, us, not being angry enough. We don't hold our leaders accountable. So yes, let's have a law.
Okay.
If the law is flouted, or if the law is not ordered, or is not followed, what do we do as a people? So they come to us, election year, have a law. Yay, we'll have a law.
Right.
There is a law. The law is not being followed,
then it becomes a
or
challenge.
it's not being abided by, who is going to hold them responsible?
I see. Great question.
You
There
know,
was
so,
Nana
yeah.
Bwachiadom.
Are we angry as a people? We are not
Yeah.
angry as a people.
Nana Bwachiadom, there was reference to our, traditional authorities, I believe, from the audience.
Exactly.
We now have the opportunity of listening.
So Nana wants to make a contribution as to what we have said so far.
Yo, me damasipi. Efra me Nana Kwame Mponsa. Obeni basi konti hene. Akra America ne say yasi baabi a odwonfo plasmate odi ne dade e bo ho pan na eho hia pa. Em say ye ba apomudin ho nsɛm yi. Enipa bebre na aka sɛ aban a abatwa mu kɔ nya aban baako we be som puntu dwuma mu sɛ ya yare sabia sɛ ye we ba na wagya ato hɔ na sika no aye ni bi no ya de aye akoduru baabi na aye adwumayehu aye sɛbi ɔbɔfo a wabɔdam na wakɔ wura mu akɔku nam aba de ɔde ba aye kora wɔn hoe ɔnya ne hwee na ɔgya agu hɔ na ɔsa akɔpɛ foforɔ ɛkyɛ sɛ mfa so obiara ni so enti deɛ nipa dɔm no ka no ba metere ha ma ho sɛ nipa nka ɛkora nipa bɛɛdu abɔ saa asɛm no so na kyerɛ sɛ ɛyɛ ade a ɛhia ɛdi yɛnya paa sɛ mobɛtumi aboa yɛn di a mo ne amayɛnfoɔ no nkasa na ɛnyɛ ɔnhyɛ sɛ aban bi bɛpɛgya dwumadie bi ɛfa yaresabea anaa mposku biribiara ho ɛsi hɔ a aban foforɔ ba a ɛnyɛ ɔnhyɛ ma no na ɔntoa so na me deɛ mehu sɛ ɔmo ba a ɔmo ntoa so de sɛ yɛ ade yɛ ka yɛ tete asɛm biara nso ni hɔ a baabia ni hɔ a ewisie hɔ a egya ni hɔ yɛ tete sɛ yɛ ma adwuma no a ne yɛagye percentage nti sika no yɛgye percentage na edi a wona me na megye percentage no a me nua ba a ɛnam sɛ ɔno wanyɛ bia ne nti no ɔgya ɔno ɔkɔpɛ na ɔno nso bɛnya ho percentage saa suba no ɛbɛyɛ fam nti wobɛtumi abɔ yɛn deɛ ɛhɔ ko adeɛ.
Is there any project you want to see from the political parties?
Come again.
Any project?
Project there. On say, me who be crying who tepa. NDC by year tepa. General Hospital. Or buy or call no NDC buy MPP buy wabetuaso. Na your projects review on more. I check the refifi. Kufuor started, and so NDC aban no ebe so Kufuor mu no buy omo anye omo jato ho omo so be ye omo dia omo na NDC ni kasa enya politics na me ye o kasa no omo reference bebre say hospitals a omo buy ya omo be ye o se be 10 or 8 Asante region 8 hospitals a omo ebe ye ya omo jan ho bebre da so ho ebi no de ye kan or bi na mo wɔkyerɛ baako no ɔse kɔdongo 60 bed capacity yɛne de anya ndisi na hyɛ aseɛ nti ɔma obi ante sɛ ɛyɛ MPP na bɛhyɛ aseɛ no wawie ɛhɔ na meka meda wase
project be na opese
ababa ɛno na meka sɛ apɔmuden ho project deɛ aban bia bɛhyɛ aseɛ a wɔnwie yɛ no yɛde na mepɛ sɛ aban bia ɔbɛba bia no ɔmmɔmɔden na ɔnwie na ɛnhyɛ Ghana nimunyam na mampuntuo so mmra.
So, all right. Yes. So, Blessed, all that he's saying is that when a party takes over from another, they should make sure that they do complete health projects, mainly that the previous government would start, and also that's been a concern generally.
I see. What I want us to do now is to move right into education. Nanayao.
So before,
okay. Yes. Let's go to Nanayao Bwachiadom, who's with us.
Before we wrap up on the health issues. One of the health professionals I have with me here, whispered into my ears about some challenges in some of the newly constructed hospitals or health facilities in the Ashanti region. Essentially, what she is saying is that some of them do not have standby generators, specifically the Konongo Government Hospital. And for that matter, if or whenever the lights are off, they have to hold on or halt with the service that they are offering in the health facilities. So their plea is that the political parties should ensure that all the health facilities that they will construct or they intend to renovate, they include standby generators and other sources of electricity to ensure that these health facilities can run throughout the day. So this is one of the concerns that I've been picking from a health professional here.
Great. So let's move straight into education. Eugene, you have anyone with you? Okay, yes. Let's start from the front.
Yes. Hello. So my name is Tijani Mahmood. I work with Muslim Family Counseling Services. On education, I think I want to make a comment on the free SHS. I know it's a political promise that this government came and they wanted to do it because they promised what they are doing. But what I want us to see is the bigger picture is that we need to be looking outside the box. Yes, maybe when we were in opposition or when the government is in opposition, we thought that we had enough resources to be able to ensure that each and every young person who is of school-going age, we can fund and make sure that that person goes to school for free. Reality check has revealed that there is really a lot that should be done. And maybe our resources is not enough to be able to take care of all the educational needs. We just need to sit down and then assess the current system and not be boxed into our political promise and think that if we do that, it means that we are failing on what we promised the country.
So practically, what would you want the political parties to commit to?
What I want them to commit is to do a real review. We shouldn't see a review as maybe a cancellation attempt, but then a review to show that, to see that if there are calls about people can afford, certain people can afford, and even I can remember the former finance minister, when he was speaking as an individual.
You mean the immediate past?
The immediate past.
Right, okay,
there was a forum that he said that for him, he thinks that, for instance, he himself is not right for his child to be enjoying free SHS, which means people can afford. And I remember my brother here talking about data. We have data in this country where we can track people who can afford, as the experts are saying. I don't understand why we collect data on people and we don't use that data to inform our
so you are asking
political
for
principle.
a review.
A review, and where we think that the government resources is not able to afford for everyone, then we should move towards targeting and ensuring that those who
has
can
a take
afford
on targeting.
will pay.
We'll hear his thoughts and see what the political parties also have to say about that. Yes? All right. Please introduce yourself.
Please, my name is Kojo Usu. My concern is inadequate teachers at the rural areas. My concern is there should be an intentional plan of all the political parties to move teachers to the rural areas by giving them special incentives. For instance, 40% salary increment to those in the rural areas.
Are you a teacher in the rural community?
In fact, I'm a teacher.
So you want you want a 40%?
You see,
please, if you support him, just give him a round of applause. Let's see if the 40% will work. Not entirely everyone agrees with you.
Yes. You see, there should be an intentional plan.
Yeah, 40%.
Yes, 40% to teachers, and they will intentionally move to the rural areas.
I see.
That's my point. My second point is on the assessment of students. You see, WAEC in the senior high school, they pay 26 cedis per paper. And going to pay 20 cedis per paper, then it is easy for a student can even influence the invigilator. 20 cedis per paper, it's easier for a student can easily influence the invigilator. So I think they should pay the teachers very well.
Is this official?
Oh yes, and I'm sure they are aware.
Okay.
You see,
40 cedis?
No, 20 cedis.
20.
Yes, per paper.
Okay.
And that's very bad. On the same issue, for instance, if a teacher is at Bushia Senior High School, the teacher should not be allowed to invigilate their own students, but should be allowed to invigilate students at, let's say, attachment senior high school, so that it will help to reduce this examination malpractices.
Okay. I see. Two critical issues you're raising there. Kofi, you want to give a quick thoughts on these concerns? Because I recall you did some work on the integrity of the examination process and then the targeting of free senior high school.
I think we touched on the issue of examination fraud.
Yes.
And how detaching teachers from supervising their own students will help, bring a layer of true invigilation, both at BEC and at WASI level. We also touched on the fact that when the State Administration invest in examination supervision such that technology is brought in to support the human element involvement, so that we can monitor the examination room to prevent examination fraud.
He's talking of 20 cities?
I'm aware that's how much invigilators are paid. And even for that, sometimes they are paid 9 months or 10 months after. The fact is that while that amount is very low, we don't believe that the right way to go is to pay teachers to invigilate their own students. Yes, it will be costly to, let's say, to engage media persons or police personnel or any other personnel to invigilate students, because they will negotiate. For teachers, they can't negotiate. Anything wise, give them, they take it.
They take that.
So we must depart from that narrative. On the target of the free senior high school, that has been the commonest issue going around the whole country. That as a country, we have data to determine who cannot pay, which is the Ghana Household Registry System, based on which we pay LEAP every bi-monthly.
So we use that data.
So we can use that to determine who cannot pay. And we have data to determine who can pay. As I mentioned, if you put in DVLA, if you put in your Senate, income tax, private health insurance, we have about 5 or 6 or 7 data sets that can easily determine, including land registry, that can determine that by virtue of you owning a car or a land or paying X amount of money as Senate or income tax, you should be able to afford 2,400 cedis a whole year in senior high school.
Interesting. Nana Aljima?
Yes, I'm Dominic. Focusing on education. For education in the rural area to succeed, I think we should focus on the education, to focus on the teachers. You go to some rural areas and the teachers has no accommodation. There's no teachers bungalow for the teachers to stay, and the teachers are from far places. So if that happens, it is a challenge for them. Some crosses water before they get to their teaching destination. So if it happens that way, some seek for transfer and they go to urban areas. And the rural areas, you go and the 2 teachers.
Are you a teacher yourself?
No, please. No, please.
Right.
So you go to some rural areas and you only find 2 teachers teaching primary 1 to primary 6, and which is bad. It doesn't help educational system in the rural area to succeed. So they should look at it, either to provide more accommodational system, or they provide means of transporting teachers from maybe urban areas to rural areas, which will help them so that they can facilitate.
Okay, if you're a
teaching
teacher
in the
here
rural
and
areas.
perhaps you want to make a quick comment on that, you can just draw our attention.
Yeah, so
okay, yes,
I have
before
a teacher from
Eugene, yes.
Offenso. I have a teacher from
That's great.
Offenso.
That's great. Let's hear you.
Thank you for the opportunity.
Please introduce yourself.
I'm Perfect Aseinani.
Okay.
From Offenso Municipality.
You are a teacher, correct?
I'm a teacher.
Right.
I would like to touch on the free SHS. Free SHS is a nice policy. It has helped so many people. But I think that there are so many things that need to be done. It might be free today, but it's a fee to pay. Why am I saying this? What is the main objective of free SHS? Is it to provide quality education, or is it about the quantity or the number of students that has benefited from the free SHS? Now, when you come to the grounds, you see that things are not working well, but they are not telling us the truth. I don't know whether they have feedback from the grounds, what is actually going on. I dare the NDC and MPP to boldly come in their manifesto and tell us how they want to review this SHS, the free SHS, because it's costing us a lot.
Right.
And I would like to suggest that Ghana need more of the TVET and the vocational education. So they should make the TVET free. Vocation should be free. But if you want to go to SHS, partially the government can take part and leave the rest for the parents to do. Now they are in school and feeding them is a problem. But the government is still insisting on free. Our kids are being starved. So I urge the NDC and the MPP to come boldly and tell us what they want Ghanaians to benefit from free SHS. Is it just the number? Did they just want to name from themselves? Or they want the quality life for the kids? Thank you.
I'm grateful for that intervention. Let's do, yes.
All right, so from the Ashanti region, she has a contribution. So. Right.
Okay, I'm Kristen Osei. Thank you. Please, I think my sister just made a pass of my suggestion with respect to the TVET education being free. To me, it shouldn't just be free, but it should be made very attractive. Students completing TVET education should also be given equipment to start their own business. In doing so, I think the rate of unemployment will come down. They will also employ some of their sisters or brothers in the house. Thank you.
Okay, for the sake of time, let's do the, yes, the lady there, and then we'll go to social protection. Yes.
Pacho, within the Nestinejima, said school who assembly king. Na mini pi no first no na yeka technical school a no obi kwa no feel proud if he say o won nsa no adwuma ade no de to ho so a obetimi aye na mehu say kwa me nkroma sua ponsua esi ho ye say ye frɛ no technology anka mo ye technology nanka emofra na said the government take say free education no Medie, minyansem a anka meka se omo nsone so from 1 to 6. Womo no beko, womo no ye doctors ni engineers ni ade no. Womo maka no, mumma womo nko sa technical institutions no. Na sa technology fuoi, komo fu omu nimdie no. Emetete nkola no. Se de be ya, omu di omu free ahyase na, omu nyini no. Endru sama kombe ko SHS no kwa no mu nim bibiye. Even your phone so you say China phone call na ye. China phone call ni bibia ye. Yan call ni mo hwe. Bibia ni ho muntim de o mo nsa ye. Enti yesrɛ mpanyimfo NDC ni MPP. Yesrɛ mu say mo manifesto na mo ba hwehwɛ no. Mo fa nhyem sɛ mo so mo betre ni nkola no firi mo mofra ase. Amo mahu sa ensa no dwumafo no ye. Eba sa o man ni bɛkɔ nanim. Omani betumpon sikabeba omani muso.
Eugene, quickly, yes.
So Mama Ernestina Jima was saying that when she was quite young, those who were going to technical school felt proud because after school they can set up their own shops, they can employ people, and they were very viable after school. So she suggested that when you come to Ashanti region, we have one of the foremost universities, the Kwame Nkrumah University of Science and Technology. Right. So according to her, she suggests to the political parties that the best students should be taken to the medical schools, engineering and all that, and the others diverted into technical and vocational training so that they can produce jobs and all that. And she said that the most youth in the region cannot do anything. And she has said that some kids in China even produce the mobile phones we use. So she is expecting that government invest in the TVET so that our own Ghanaians can do some of these things.
All right, Blessed.
Yes, and I think that will be the last one. We get the reaction of the political party so we can do social protection. Yes.
The regional secretary of the Ghana Private Schools Association.
Let's hear you, sir.
All right.
Your name again, sir?
I am Nicholas Bambuni. The role of private schools in the country cannot be underrated, ranging from preschool to the tertiary level. In fact, taxes on us is too much. NACI on us, NTC on us. It's everywhere. But when it comes to policies, we are not included. When it comes to policies like maybe like the one, what do you call it? One student, one tablet, they say we are not included. Everything, books from whatever, private schools in Ghana, we are not included.
So how do you feel the political parties can address that?
No, they have to include us. Okay. They have to include us, include in their manifestos that private school, free SHS, will also enjoy it. Otherwise, our children are leaving. You go to the secondary school right now, know that you count 1, 2, 3, and they are all gone to the government schools. Okay. So it's making our work difficult. So now that they are here, we are praying that they should include the private schools.
And they are here, so we'll put that to them. Nana Yaujima, you have the final person we'll be speaking to on education.
Yeah, so I have one gentleman from the Ashanti region, and he has promised to be very brief.
Brief about the point. Yes, sir.
All right,
go ahead.
Thank
Your
you.
name?
Akepa Michael Adumble. Yes, we are talking about exam malpractice, and we are not seriously tackling it. The thing is, the teacher is now powerless as far as the classroom is concerned. And if you're a teacher who wants to, or an invigilator who wants to be straight in the exams hall, then you will not get to the house. There are even teachers that would have to vacate the school with their families before examination even take off, because they are those who are said to be very disciplined. And candidates will not take lightly when they are in the school at the time exams are going to be taken. So it's something that we have to look at. But what is causing this? We promote wholesale. No student is withdrawn for not performing. As soon as a child is admitted in the first year, the third year, the child will appear, and then the ministry says that you must register that child and let that child write the exams. I mean, the child has been in the house for all that long. So what will the child write? So definitely something will happen. Thank you.
Thank you very much. What I want us to do is to just merge the issues before we come to the political parties. Kofi, you have any comments on education? Yes.
I don't want to sum what they said. Putting it together, it reflects the position that has emerged across the regions about the growing or the widening gap between the state of basic education in urban areas and in rural areas. And the fact that education, instead of being an instrument for reducing inequality, is, if you don't take time, is becoming an instrument for widening inequality, because we have a system where the state of infrastructure, the state of teaching and learning resources, including teachers, in the deprived district is the opposite of what we find in endowed municipalities. Yeah, so I think that our political parties must take a second look at how they deploy resources, including infrastructure, financing resources, teaching and learning resources, and teachers, and then have a strategy
briefly.
to bridge
The private schools, they are here. Let's see if that's feasible.
Yeah, the private school issue is a bit tricky. It's a bit tricky in the sense that there are some interventions that government is even unable to provide for public schools. As I speak to you, government provided 9.5 million textbooks for primary schools. We've done 4 years of a new curriculum and 3 years of the junior high school curriculum for junior high schools, but we don't have textbooks. Okay, the first batch of junior high school students who use the new curriculum are writing BECE in a couple of weeks. We don't have textbooks. Right. So it will be a bit out of context for you to expect government to provide textbooks for private schools when public schools do not have the full.
Perhaps a new policy.
That's the reality on the ground.
One of the policies.
But there are some policies that discriminate against private schools that I was expecting them to rather amplify. But they have amplified it earlier in the day. Right. One of which is the placement into public senior high schools. That the computerized school placement disadvantages or discriminate against students who attend private junior high schools. Right. And it is not their fault that they attend private junior high schools. They are Ghanaians. I think that is discriminatory, but not in terms of government providing textbooks. It is unable to provide for all public schools.
But it's doable, is it?
Pardon?
It can be done by any of the political parties that committee.
Oh, yeah, well, the NDC has promised to expand the free senior high school to cover private senior high schools.
So let's see how that will go. And perhaps this will be a good time to hear from the political parties if they plan to do anything as such. And then quickly we do social protection. Yes. So yes. So okay, let's go ahead, do social protection, and then we wrap up, and then yes, and do all of them at once. Eugene.
Pleasant.
Yes, we have someone doing yes.
Yes. So I have a gentleman here.
Pamcho, medin de openi opuni apia Executive Director, Pankrono Development Union. Me how me pese ye nyina ye hwe na ye sia no say esi tafo ene Pankrono enipa bebre ani ma so the whole of last 4 years social protection nema bebre wa ya ansa anka efiri assembly na anya adwuma because assembly na anya adwuma mfie mienu omu antimi anyi presiding member nso enyi ya assembly no nya adwuma omu di kan ansa na presiding member no obedi nkunim no also nipa no do no onyam abupa miensa assembly members any appointees obi aduonu num also onya du nwotwe omu yi assembly members mienu obi a ni nkunim ana omu tira ansa ati obi a ni nkunim ene ye share da foforo ye san the assembly members mienu bai obi a ni nkunim ene yi omu nso free ho ena omu ade ba ko bai ena omu gi ni to mu ba ko na adwuma mfie mienu say ya to abaya san the assembly members for aba any years we be challenge no so ye adwuma to obi en challenge no nti aka se ekwa akogina to mu ohia nipa du nwotwe omo to first one we anya du nwotwe no omo to second one we anya du nwotwe ne yina ti nchen mpacho ye yina ti nchen ti misramo ayi no we manifesto no a say ye ka akire ye ni presiding member ti bi o manifesto no o betimi di bibia hyem sa assembly members ne ade no kakra bi no ene di tetima community no ye be change na enka ebeboa.
All right. Eugene?
Yeah, so he's talking about the Tafo Prankrono Municipal. And he's saying that for almost 2 years, they didn't have a presiding member. They finally had one, and new assembly members were elected. And they wanted to change the guy incumbent, and he didn't also get the necessary 2/3 vote of the assembly members to be re-elected. So they do not have presiding member, and that is affecting their local governance structure when it comes to the Tafo area. So they want the parties to ensure in their manifestos how that system will be changed.
Okay, because we are wrapping up shortly, we need to be brief about the points you're raising. We do one more, and then yes, yes, Jima, yes.
Me pacho na me di kan akọ afa ye more fran especially a single parents no. And say broken home say bi a kwala omo maame na omo papa omo ejai no. Ya na edu ba bi a issues no emu eden kakra. O de omo beko social welfare nso esa na omo ni support to be omo dey support nkwala no. Boys na boys na wakoka am robbers ho ene sa drug abuse na chese o de ebe ha yen. And now secondly, about a jashishia na last one. In fact, edu baby ya na ye send any meko. So why your investment as a typical example for region. Just last year, 13th February. Mushroom. Onipa deseni aye. Wahu. Obija eshini ya say bibia. Emma fire said for be bibia. Not mo bibia or honoma. Just not mo current me and supporto. A lady no when the investment no ye farm crop for single women among mu ye adwuma bibi but no chia tax e wo assembly hono enti mesrese politicians mesremo samaba ye mrantie na omo na number sa na because of single marriage problems no e ba no ye sremo ye nhwe how e be engage omo.
All right. Eugene?
So blessed briefly she raised two issues from the Afro region. She's talking about streetism and kids going wayward, and he believes that the political party should incentivize and resource the social welfare department so they can take care of that.
Grateful for that point.
Yes, and secondly, she also raised issues about the fire service. That there's an incident in the Afro region where a farmer and also someone into the support of women lost her property. Though she was paying taxes, the state couldn't come to her aid to at least raise the money for her. So she believes these support systems must feature in the manifestos of the parties.
Let's go to Nana Aljuma, but before then, there's an intervention from Dr. Tetteh briefly on why the political parties must appreciate social protection. I think a lot of us, when we talk broadly about social protection, we tend to lose sight of how important it is, and even we don't get to, appreciate really what the challenges are in this space.
Okay, so essentially what I wanted to do was to remind us about the earlier discussion on social protection so that in our submission to the political parties, we are more targeted towards the issues, so we don't have issues that are coming outside of it. Right. So what we had said earlier was that the financing for social protection is really low, and social protection goes for people who, for many vulnerabilities, several vulnerabilities, are not able to develop or are not able to access their essential rights and basic needs.
Yeah.
And we talked about poverty, we talked about disability, geographical location, we even talked about gender. So these are the issues we want them to focus on in their submission so that the parties are able to pick up
the issues. And I believe that will be one of the areas we are dealing with next.
Yes.
Nanael.
So I have Priscilla from the Ahafo region here.
Okay, so good evening to everyone. My name is Bona Priscilla, and I am the founder for Trio Nidiham Foundation. And then we are measuring on people, less privileged people, and then people in the deprived area. And my concern on the social protection is about the rent advance policy or law that we have. And then since we are looking at less privileged people, I believe that we have a lot of people in our community that are less privileged. And so I want to request or suggest that our politicians should also look at this policy, because I believe that when you look critical to the policy that talks about how many days that a tenant has to, move from a house that maybe he or she is renting, you will see that landladies and landlords are ready to ensure that this particular days, the tenants don't, kind of surpass those days and make sure that they moved out from their house at the time that they will give them. So I'm looking at politicians or the governments also ensuring that this policy is being implemented or enforced very well, because we have young women and young men that are coming up, but then when you look at the amount of money that they are supposed to pay if they want to rent, typically if you want to go and rent for a room that is going to cost you for 100 cedis a month, and if you are asked to pay for like 2 years, and if you are a young graduate that you just finished where you want to move to another community or another country, it becomes a challenge. So I want to request or suggest that they will look at that policy for us. Thank you.
Right. Let's do the next.
Blessed, this
gentleman
is Inusa Nto from Kentampo.
Thank you very much. I would like to commend Star Ghana, first of all, for a program like this. We, the youth, have always looked around to have opportunities like this, at least to get involved in national issues of national interest. So beginning right away from this, at least facilitated by Star Ghana, we commend them for that. First of all, I'm very happy the political parties are here to take reports to their various parties. And also, we have a Fulani chief here representing the Fulanis in the Ashanti region, and he works around. There is this problem, an annual, that happens in every year, especially when you are at the rural areas. A clash between the Fulani herdsmen and that of our various farmers. This has been a situation or occurrence that happens every year, and the situation is worse when you are around. And likely this does not happen under any government. It happens under any party that comes to power.
Right.
So,
what would you want to see the political parties do?
Yes,
for the sake of time?
at least sit down, or it should be part of the manifesto, on how resolutively they can solve that problem. Because the Fulani herdsmen and their work is very important to our economy, the same thing as the farmers. But there has always been a problem. Yes. So going forward, both parties, we don't know, both parties, because Ghana currently, though indirectly, I can say we have two-party system. So whoever, but there should be a resolutive means by which these two important issues, at least between the Fulanis and the farmers, will be resolved.
Right straight to the political parties, so we can hear what they have in store. But we'll be brief about that. 30 seconds each for all of you, and then we hear from the political parties, and we can wrap up. Go ahead, sir.
Okay. Medasi. Pacho mebra nasab na wakan. Efa PM na omo select no assembly no. Mesusu say nkomo ye ne simple majority a anka beboa. Because 2/3 no, gire wonya 2/3 ansa na wati media anwene. Wo ye dan a ninya na edin. Eho na masikatua ba mu no. It is omo ye ne simple majority. Wonya 1 ana 2 a wanwene.
50% plus 1.
Ana 2. Disability common fund na omo de ma persons with disability no. E wo mu say ye mo besia wo. Esan hye mu say assembly ni sika omutimi bobesia efrim omunya anom dia behiem. Right. Enti me pese two political parties no then on by found some mobile, who's a more busy.
Nana Yaojima, yes, quickly translate that.
So he raised two issues. First, he is talking about the disability, the common fund. That's the portion allocated to persons living with disabilities. And he thinks that it's about time that the political parties commit to ensuring prompt payment of these money that is allocated to persons with disabilities. He is saying that he knows that there's a law guiding against these assemblies taking loans from the money, but he knows that the assemblies have been doing that, and he wants them to commit towards ensuring that they do not do that again. And he is also calling for a change in the regulation that is used to elect presiding members in various assemblies. He wants it to be done by simple majority.
I see. Apologies to all of you. We've run out of time. So what we need to do is to give, I think, 2 minutes each to the political parties. Then we wrap up on stage. We start off with the NPP this time round. Razak?
With regard to the issues of social protection and then disability, what we did promise Ghanaians, we are still on it, and we are going to continue on it. But with regard to, as I always say in this country, politician is the easiest target. Politician is the easiest target. Like the one he said, that there is a law, which says that the district assemblies should not touch the persons with the disabilities fund. The district assemblies are touching it, which he says he's aware.
Okay, so what are you committing to, for the sake of time, briefly?
Because we should all make sure that the laws works. It's not always that we should look at the political parties.
I see.
So if you know that somebody is perpetrating a crime that we need to talk about it, take it up as a citizen.
So
but we don't sit down and say that always political parties, always political parties.
I see. Be a citizen, not a spectator, I guess. That's basically the point you're making. Grateful. Yes, Abbas?
Well, I will touch briefly on
we need to go so
the
very
challenges
briefly,
raised in the educational sector, with special emphasis on the free education. My nephew went to school as a first-year student for 1 month, 2 weeks. He came on May terms, and she received a message that she would have to stay for almost 3 months more because he would have to make way for others to also come. This is the reason why the NDC, led by President Mahama, is promising to review the free education by eliminating the double-track system. There are 450 private secondary schools in Ghana. If we are able to even bring half of them on board, double-track will be a thing of the past. Now I have enrolled her. In a double-track extra classes, and I'm paying 1,000 Ghana cedis a month. So you can't say the education is free for me.
Okay,
but if you are able to get everybody going and coming home at the same time, this cost would probably be eliminated.
And it's just unfortunate that we've run out of time. Thanks to all of you who've been a part of the Ghana Connect Town Hall here in the Ashanti Regional Capital, Kumasi. Grateful to Abbas Nuruddin, the Ashanti Regional NDC Communications Director, and also to Abubakar Razak, who is with the YEA. But I'm grateful also to Kofi Asari of the Africa Education Watch, and then to you, Dr. Dr Tetteh, for spending some time with us. We'll see you again on the Joy News channel. This is your election headquarters. And please do one more time a final round of applause for our panelists and to you yourself for doing a great job. My name is Blessed Sugan, and of course, keep watching the Joy News channel. We are your election headquarters, and Joy News is independent, fearless, and credible. Thanks for watching. Bye-bye. We're grateful to the crew as well for doing an extremely extraordinary job on this one. To Loretta and to the rest of the team doing a great job. We are indeed grateful to you. We'll see you again. Bye-bye.